Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to the channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell button so that you can be notified when a video is uploaded. Kindly share the videos with others or in the internet. In the last two episodes of Know Your Body segment, we clarified the role of neurotransmitters of the brain in facilitating us to be happy. In this episode, we focus on the role of the brain, especially the limbic system and the frontal lobes of the brain, in making us feel happy. Two important areas of the brain associated with emotions in general, particularly with the emotion of happiness, are the frontal lobes located in the area of the forehead above the eyebrows and the limbic system, which is deep inside the center of the brain. Generally, these two areas interact with each other to influence our behavior, emotions, thinking, and what we are going to do with life. Thus, they have a profound influence on our personality, who we are, and how we feel. Though emotion of happiness originate in the limbic system, namely in amygdalae, hippocampi, and hypothalamus, its actual experience is facilitated by the frontal lobes of the brain, particularly its most important portion, the prefrontal cortex. Our prefrontal cortex gives us the ability to experience happiness and enjoyment of life. Besides, the prefrontal cortex is responsible for other important positive human qualities such as idealism, joy, our ability to concentrate, creativity, and our ability to think abstractly. The prefrontal cortex and the limbic system work hand in hand to influence our experience of happiness and other positive emotions. Thus, prefrontal cortex interprets situations and events and communicates that interpretation through the frontolimbic loops to the limbic system, which then produces the emotion of happiness. Since there exists constant and regular biochemical interaction between the limbic system and the prefrontal cortex, and the prefrontal cortex is involved with both higher levels of thought and emotion, it implies that our thinking affects the way we feel and our feelings affect our thinking. If this is true, we can intentionally use our thoughts to change our feelings in a significant way. Often, negative thoughts produce negative feelings, and positive feelings stem from positive thoughts. If we can intentionally replace our negative thoughts with positive thoughts, we will be able to produce positive feelings in place of negative feelings, thereby experience happiness instead of sadness. The functional magnetic resonance imaging technology, commonly known as fMRI technology, that measures the blood flow to assess brain activity, has shown that the left side of the frontal lobes, known as the left prefrontal cortex, is more active when people feel happy, and the right side of the frontal lobes, known as the right prefrontal cortex, is more active when people feel sad. Hence, by learning what stimulates the left prefrontal cortex, we can train people to be happier. Similarly, by learning what calms the activity of the right prefrontal cortex, we can train people to reduce sadness. As a matter of fact, cognitive behavioral therapy used as the treatment for anxiety and depression aims at changing unhelpful thought patterns, emotional states, and behaviors in people and replacing them with healthy thought patterns, emotional situations, and coping strategies in order to solve their current problem is based on the above said assumption. When we can do this, we strengthen the left prefrontal cortex, namely the feel-good center of the brain, thereby experience greater happiness. Some activities that strengthen the left prefrontal cortex are the following. Practice of meditation and concentration on breathing can strengthen the activity of the left prefrontal cortex and reduce the activity of the right prefrontal cortex and increase happiness and reduce sadness. Having positive social interactions, engaging in meaningful activities, doing things that would keep you focused and calm, spending time with your loved ones, getting involved in creative projects, celebrating accomplishments, having positive thoughts and feelings about yourself and others, doing regular physical exercises, and any similar activities can stimulate the left prefrontal cortex and increase happiness in your life. By engaging in these activities, you are in fact changing the way your brain works. And by doing this, you can change your life for the better. I would like to conclude this video by giving you a short exercise which you may do when you find some quiet time for yourself. It would be good if you do this exercise in writing. First, think of a situation in your life that has made you deeply sad, distressed, angry, and frustrated. Give a name to this situation. Second, write down 5 or 10 sentences describing the situation. This description could include your memories of the event, people involved, and how the situation made you feel, or any other relevant fact. Third, write down 5 thoughts, beliefs, or self talks that you had as you lived through the situation. These thoughts could be about yourself, about other persons involved, about the situation, about the divine you believe in, or any other matter related to the situation. Having made the list, arrange them in the order of importance. The most dominant thought should be listed first, and the least dominant thought should be listed last, and others in between. Fifth, choose the most dominant thought, belief, or self talk for further consideration. Write down the most dominant thought on a sheet of paper. Give a name to it. Ask the following question relating to this thought. Is this thought true or right? Is it useful to me in this given situation? Does it help me to cope with the situation I am facing? Can I afford to have such thoughts to guide me without serious consequences on my life? Can I modify this thought so as to help me cope with this situation? How would I formulate the modified version of the thought? Please write down the modified formulation. You can evaluate each of the 5 thoughts you have listed and modify them. Begin to practice the modified version of the thought or thoughts in the context of your life. Your practical living out of the modified version of your thought or thoughts will change your feelings about the situation and will bring about changes in your action as well. You may opt for acting in a different way than you have acted before. This exercise is a modified version of the cognitive behavioral therapy. If you learn to cope with painful and difficult situations, using this technique of modifying your thoughts to change your emotional states and your actions, which in turn will pull you out of the painful situation and lead to a greater state of happiness and peace. Thank you for watching this video. Stay blessed until we see you again with another video.